The letters in CPR stand for cardiopulmonary resuscitation, a combination of rescue breathing, mouth-to-mouth resuscitation, and chest compressions. If a child is not breathing or circulating blood adequately, CPR can restore circulation of oxygen-rich blood to the brain. Without oxygen, permanent brain damage or death can occur in less than 8 minutes. CPR may be necessary for children during many different emergencies, including injuries, near drowning, suffocation, poisoning, smoke inhalation, electrocution injuries, and suspected sudden infant death syndrome (SIDS). Reading about CPR and learning when it's needed will give you a basic understanding of the concept and procedure, but it's strongly recommended that you learn the details of how to perform CPR by taking a course. If CPR is needed, using the correct technique will give your child the best chance of recovery. The three basic parts of CPR are remembered as A, B, C. A is for airways, B is for breathing, and C is for circulation. There are 6 steps to do CPR, then we go step by step. Now, for the first step is check the victim for unresponsiveness. Use A, B, C. If there is no response, then call 999, or you can ask someone for call 999, and then you just look for the victim if there is response or anything else. Second step is position the person flat on their back, kneel by the side, and place hand on the forehead and the other under the chin, like this. Tilt the head back and lift the chin until teeth almost touch. Look and listen for breathing. Third step is give through breath. If not breathing normally, pinch the nose and cover the mouth with yours. Give 2 full breaths. The person's chest will rise if you are giving enough air. For example, like this. And the victim chest will rise. Then we should go to full breath 2 times. Fourth step is check pulse. Here, put the fingertips of your hand on the neck, slide them into the groove next to the windpipe. Feel for a pulse. If you cannot feel a pulse or are unsure, then we go to the next step. Fifth step is position hands. Position your hands in the center of chest between the nipples, right here. Place one hand on top of the others. For example, like this. In the center of the chest. And the last step is pump 15 times. Here, like this, at the center of the chest. Push down firmly 2 inches. Push on the chest 30 times. And 2 blow for 5 times within 2 minutes. For example, like this. Then you push down firmly 2 inches. Push on the chest within 30 times. After that, 2 blows for 5 times within 2 minutes. and repeat again 5 times in 2 minutes. If there is still no response, then we have to go to the next. After we are done all 6 steps of CPR, then we can continue with 2 breaths and 15 times pumps until help arrive. A person might need CPR if a situation that call for CPR include cardiac arrest, near drowning incidents, suffocation, or any in which a person is not breathing. The goal of performing emergency CPR is to ensure the circulation of oxygen rich blood to the brain. CPR is an emergency procedure that can help save a person's life if their breathing or heart stops. When a person's heart stops beating, they are in cardiac arrest. During cardiac arrest, the heart cannot pump blood to the rest of the body, including the brain and lungs. If a cardiac arrest victim is breathing normally, you don't need to perform CPR. Oxygen-rich blood is still getting to their brain and the heart muscle is functioning for the time being. So if a victim is still breathing, just put them in a recovery position, then call 999 or 911 and wait for healthcare providers to arrive. For a quick recap, with the right CPR knowledge, we can at least give early rescue measures to the people around us, family, friends, and the general public, as an initial preparatory step before the arrival of medical rescuer.